When you think about pain, it's common to think about an injury or a specific condition that has caused damage to the body. But here's the thing, it's not that simple. Pain can stick around long after an injury has healed. And in cases of chronic conditions, it can feel far worse than what scans or tests reveal. This can be incredibly frustrating for people with chronic pain, especially when medical providers say, your condition doesn't look that bad. Sure, it might not show up as severe on an image or a test, but that doesn't mean it doesn't feel horrible. So what's really going on here? Well, research is uncovering that your nervous system and brain play a massive role in how pain is felt, and they can keep amplifying it long after the body has physically recovered. But here's where things get tricky. Most of the treatments we rely on to manage pain are still focused on the injury or the tissue damage. And let's face it, they often don't work. And despite all we've learned about pain, we're not much better at managing chronic pain today than we were decades ago. We keep using the same old methods and keep getting the same marginal results. So what's the alternative? Well, in this video, we'll be diving into evidence-based approaches that can help you finally break out of the cycle of pain, offering you practical tools to regain control and finally experience some relief. Chronic pain can occur when the body's pain processing system becomes dysregulated. This often happens after an injury or due to conditions like arthritis, nerve damage, or repetitive strain. In the initial stages of injury, pain serves as a protective response, signaling the brain to promote healing. However, sometimes even after the tissue has healed, the nervous system remains hyper-responsive, continuing to send pain signals long after they're needed. This heightened sensitivity, known as central sensitization, can cause normal sensations to feel painful, making recovery longer and more frustrating. We talked extensively about the science of pain in our previous video, so check that out if you missed it. This is why managing chronic pain isn't just about treating physical symptoms or trying to cure it. Instead, the focus should be on learning how to manage it, understanding how the nervous system reacts, and finding ways to break the cycle so that pain doesn't control your life. However, the challenge is that our medical system often encourages a reliance on healthcare providers for solutions, with the expectation that a single treatment or intervention will provide lasting relief. This creates a cycle where patients are constantly seeking a quick fix, hoping that one procedure, pill, or therapy will solve their pain. But the reality is, this approach simply doesn't work for chronic pain. The complexity of chronic pain requires a much more holistic, long-term strategy, one that addresses not just the physical symptoms, but the mental and emotional aspects as well. It's a multifactorial issue, and overcoming it requires a personalized, well-rounded approach. So what actually works to break the pain cycle? Well, let's take a look at evidence-based treatments that can help you regain control and start the journey towards lasting relief. Number 1, understanding pain. You can't effectively treat chronic pain without understanding it, and that includes the person experiencing it. Pain is more than just a physical sensation. It's a complex interaction between the body and the brain. Recent advancements in pain neuroscience have shifted the focus from a purely physical model of pain to a more comprehensive understanding that includes the brain's role in pain perception and amplification. This understanding has led to the development of pain neuroscience education and other brain-targeted strategies. These approaches aim to retrain the nervous system and change how the brain processes pain signals. Recognizing that pain is not simply a reflection of ongoing physical damage, but also a neurological process, allows people to take a more active role in the pain management. Research has shown that when patients learn about the mechanisms of pain, they experience significant improvements in both pain perception and overall quality of life. This is because the understanding of pain helps to reduce the fear and anxiety that often accompany it. When people realize that pain isn't always tied to current injury, they're less likely to catastrophize or avoid movements, which can actually make pain worse. Understanding pain doesn't just shift how people perceive it, though. It empowers people to take control of their treatment. When people grasp how pain is processed in the brain, they are more open to the therapies that address both the physical and psychological aspects of pain. A 2018 study in pain medicine found that patients who combined pain neuroscience education with other active strategies showed significantly greater reductions in pain intensity and disability compared to those who only received physical therapy. This combined approach illustrates how understanding pain at a neurological level can make other treatments more effective. Number 2, cognitive behavioral therapy. Once pain is understood, individuals with chronic pain can move on to more active rehab strategies that use the understanding to reshape how the brain responds to pain. Because dealing with chronic pain is about more than just managing the sensation itself. It's about changing how you think about it. Pain is influenced not only by physical factors, but also by your thoughts and emotions. Many people with chronic pain start to fear movement, get stuck in negative thought loops, or imagine the worst possible outcomes, which only fuels the pain further. And this negative mindset triggers changes in our brain. Research shows that when we're stressed or anxious, our brains activate the fight or flight response, releasing stress hormones like cortisol, which heightens pain sensitivity. Over time, this constant cycle of negative thoughts can blur the line between real injury and perceived pain, making it more difficult for individuals to differentiate between actual tissue damage and the brain's amplified pain signals. Cognitive behavioral therapy can break the cycle by teaching you to challenge these negative thoughts and respond to pain in a more healthy, more constructive way. Multiple studies have shown that cognitive behavioral therapy effectively reduces both emotional and physical impacts of chronic pain, showing a 30 to 50% reduction in pain intensity and a significant improvement in emotional functioning. A powerful tool in the cognitive behavioral toolkit is a concept known as positive reframing, which involves shifting how you interpret pain and the thoughts associated with it. When pain flares up, it's easy to jump to conclusions like, something's wrong, or this pain will never go away. These thoughts amplify stress and anxiety around your pain, making it harder to cope. Instead, try telling yourself, this pain is a signal from my body, not a sign of something catastrophic. My nervous system is reacting to what I've been through, but it doesn't mean things are getting worse. This shift in thinking can help take the fear and panic out of the experience. It's also easy to get frustrated with your body during this process, but practicing self-compassion can help. Self-compassion is all about treating yourself with the same kindness and patience you'd show a friend. Research indicates that self-compassion exercises reduce pain intensity and emotional suffering, making it easier to cope with chronic pain. You might try exercises like taking a self-compassion break, where you acknowledge your pain with understanding, or writing a supportive letter to yourself. This helps break the cycle of self-criticism and fosters emotional resilience, both of which are key to managing chronic pain. Incorporating these techniques in your daily routine will help you take a more proactive approach to managing pain. By reframing your thoughts, you're not just coping with your pain, you're changing the way your brain responds to it. Another essential active rehab strategy for managing chronic pain is graded exposure therapy. Graded exposure works by progressively reintroducing the body to activities that cause discomfort, but in a controlled, step-by-step manner, allowing the nervous system to gradually adapt without being overwhelmed. The goal is to desensitize the nervous system, reducing its heightened response to pain stimulus. This process is all about training the brain to reassociate certain movements with less discomfort over time. For example, if neck movements triggers pain, you might begin with small, controlled movements within a pain-free range, slowly increasing the intensity, range, or duration of those movements as the body tolerates them. The key to graded exposure is starting with activities that are challenging but manageable, without pushing too hard too soon. If an individual attempts too much too quickly, it can lead to flare-ups and reinforce the brain's pain response, essentially retraining the nervous system to remain hypersensitive. By focusing on small, gradual steps, the body can adapt without reactivating the pain cycle. Each exposure aims to build the body's tolerance to normal activities and motions, reducing fear and anxiety around movement, which is often a major psychological barrier in recovery. Graded exposure can be applied not only to physical movements, but also to everyday activities, or engaging in light exercises that may have been associated with pain. By reintroducing these activities in a structured, incremental way, you help recalibrate the brain's pain perception. Also, the process can boost confidence, making it easier to return to normal daily activities without the fear of re-injury or exacerbating pain. So in essence, graded exposure works by slowly challenging the nervous system to tolerate pain triggers, desensitizing the body, and ultimately allowing better movement and reduced pain. Number 4, mindfulness-based stress reduction. One of the most significant contributors to chronic pain is stress, which triggers the body's fight or flight response, increasing inflammation, muscle tension, and pain sensitivity. So, to effectively manage chronic pain, we must also manage emotional and psychological factors that can exacerbate pain. Mindfulness-based stress reduction strategies and other mind-body techniques offer powerful tools to break the cycle and help manage pain in a holistic way. One of the most effective approaches is mindfulness meditation, which focuses on staying present and accepting pain rather than fearing it. Research has shown that mindfulness can actually change the way the brain processes pain, reducing activation in the regions responsible for pain perception, such as the primary somatosensory cortex. This shift can reduce the intensity of pain and help individuals cope more effectively with discomfort. A study published in the Journal of Pain found that individuals who practiced mindfulness techniques had lower cortisol levels and reduced pain intensity by increasing the brain's ability to regulate stress, demonstrating its potential to alleviate both the sensory and emotional aspects of chronic pain. An example of mindfulness meditation is the 5-4-3-2-1 technique. Name 5 things you see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This brings your focus to the present moment, helping to reduce stress and in turn, pain. Deep breathing exercise is another cornerstone of many mind-body practices, activating the body's parasympathetic nervous system, also known as the rest and digest mode. This can counteract the stress responses by lowering cortisol levels, relaxing muscles, and reducing pain signals. Techniques like the 4-4-4 breathing exercise, inhale for 4 seconds, hold for 4 seconds, and exhale for 4 seconds, have been shown to decrease pain perception and reduce the body's response to stress. Another valuable tool is progressive muscle relaxation, which involves tensing and then relaxing specific muscle groups. This method is particularly helpful for individuals experiencing chronic pain, as it helps increase awareness of muscle tension, often a contributor to pain. By consciously releasing tightness, progressive muscle relaxation can reduce overall pain sensitivity and promote a more relaxed state. Biofeedback offers a high-tech approach to pain management that allows individuals to monitor and regulate their physiologic responses using current consumer technology. Devices like smartwatches, fitness trackers, and specialized sensors can track vital signs such as heart rate, providing real-time feedback on how your body's reacting to stress and pain. By using these tools, individuals can learn to consciously control their physiologic responses, helping to lower stress, reduce pain, and improve overall well-being. Other useful technology include apps like HeartMath or Calm, which provide guided biofeedback exercises that teach users how to regulate their breathing, heart rate, and stress levels. Over time, this training can increase pain tolerance and enhance relaxation, helping to manage chronic pain more effectively. In addition to these techniques, guided imagery can be another useful tool. By mentally visualizing a peaceful, relaxing scenario, you can divert attention from the pain and activate the brain's relaxation pathways. Incorporating one or more of these mindfulness-based practices into your daily routine can break the stress-pain cycle, reduce inflammation, and enhance emotional resilience. These techniques not only complement traditional physical treatments, but provide a holistic approach to managing chronic pain, empowering you to take control of your pain management in a sustainable and impactful way. Exercise plays a critical role in managing chronic pain by directly influencing the brain's pain processing systems and leveraging the concept of neuroplasticity. As we talked about, chronic pain involves a sensitization of the nervous system, where the brain and spinal cord become more reactive to pain signals. It's not just about improving physical health. Exercise helps to rewire the brain's pain pathways, making it one of the most effective long-term strategies for chronic pain management. When you exercise, the body releases endorphins, natural painkillers that help reduce pain perception and increase feelings of well-being. But beyond this immediate effect, regular physical activity has more profound effects on brain function. Aerobic exercise, such as walking, swimming, or cycling, stimulate the release of brain-derived neurotrophic factor, a protein that supports neuroplasticity and the growth of new neurons. This not only helps repair damaged neural pathways, but also promotes new connections in areas of the brain that control pain, mood, and stress. Strength training, whether through resistance bands, weights, or body weight exercises, also offers neurologic benefits. By building muscle strength, it helps support the joints and alleviate strain on areas affected by pain. This reduces the physical stress that often exacerbates pain experiences. Additionally, strengthening exercises have been shown to improve cortical representation in the brain, meaning that the brain's map of the body becomes more balanced. This can help improve motor control and reduce discomfort during movement. Exercise also impacts the brain's emotional processing areas, which are often altered in chronic pain conditions. Physical activity has been shown to reduce activity in these areas of the brain responsible for stress and emotional regulation, such as the anterior cingulate cortex and the amygdala. This reduction in brain activity helps lower anxiety and fear, common psychological responses to chronic pain, and can improve overall mood and emotional well-being. The key is consistency. Regular, moderate intensity exercises that challenge the body without pushing it to the point of overload. Over time, as the nervous system becomes less reactive to pain signals and the brain's pain processing pathways are rewired, individuals often experience reduced pain intensity, improved function, and enhanced quality of life. Managing chronic pain is all about changing the way you think about pain. Pain can stick around even after your body has healed, often because your nervous system keeps amplifying the pain signals. Once you realize that pain isn't always a sign of harm, you can start to take control. Healing won't happen overnight, and there will be good days and tough ones, but that's just part of the journey. By focusing on small and consistent steps like understanding your pain, challenging negative thoughts, moving your body, practicing mindfulness, and staying active, you can break the cycle. With time and effort, you really can retrain your brain and reduce your pain. It's all about regaining control and making lasting changes. Now, if you found this video helpful, don't forget to hit that like button and subscribe to the channel. We'll keep bringing you valuable insights about your body, how it works, and what it needs to keep moving.